We had a little glitch. Anyway, lucky it was not during someone's honeymoon ride. That would have been a disaster. Yeah, we'll get back to cardiac rehab. So I was just asking Dr. Vivek Jawali about cardiac rehab. So let's go back to that question in case some of the viewers missed it. So how important a part does cardiac rehab play?
You see, cardiac rehabilitation is a comprehensive big program. It's a long-term program. Somebody had a heart attack, he has to recover. It's a great blow to his mind, great blow to his body. He was bedridden, he's scared, and he has to get back to normalcy of life, where he may be a middle-aged or young man. He has to go back into full hard work. So he has to be rehabilitated, brought there. Somebody had a cardiac surgery, his bone was cut, he was in pain, he was in the bed, and then his lungs are tight, he may develop phlegm, he may develop pneumonias. He has to get back to a painless, sturdy lifestyle, and he has to live long. He has to take care of all the factors which can spoil the operation. So all that would mean, and also somebody has had a major heart attack and his heart is spoiled. Somebody has had a disease which spoils the heart muscles, and the heart muscles are bad. Then, in that case, he has to be brought back into a good state of health. All this will need a very gradual rehabilitation. And this is a comprehensive program in the sense health is physical, mental, emotional, and spiritual. So for physical health, there are exercise patterns. Then there are the preventive programs on atherosclerotic risk factors like his food, like his exercises, like suggestion of stopping of smoking, controlling the amount of alcohol he takes, and all kind of advices. Then there is an emotional support. Most of the people will go depressed because they have had a near-death experience, and they think that they are very scared, they are not in a proper state of mind, and if we don't help them to bounce back, they may develop a personality disorder of a depressive kind. So emotional support. And then there are a lot of other programs like yoga, meditation, music therapy, which can also support some people who are deeply religious. They can even dive into religion deeper. All this will support and get them back. So rehabilitation is a comprehensive program of all this. It is long term. For some time, the program experts can support, but we have to teach him to support himself, and he must not forget those lessons all his life.
Well, I'm glad. In that way, we at Sukino have almost incorporated all these things in the cardiac rehab. Yeah, now let me get back to the other question. So according to you, cardiac rehab starts right from day one of the surgery?
Yes. You can divide the rehabilitation as acute,
okay,
subacute, and long term. So when the patient is coming for surgery or somebody is coming for any procedure, let us not talk about emergency where they came with a heart attack, but somebody is planned, then before they are even admitted, we will start orienting them about exercises, etc., about the breathing exercises, body exercises. Then they come in the hospital and then they are operated. They will not wait preoperatively much. Immediately next day morning they are operated. Because they are already oriented, the moment they get conscious, the tube of the ventilator is removed, the program begins, the breathing exercises. See, the chest is fractured,
okay,
it's painful, and they are extremely scared. More than the real pain, there is a scare of pain. So you don't even know where you sometimes swallow your respiratory secretions or you sweat them off. The respiratory secretions just come out with the ciliary movement, but his or her respiratory secretions may get pent up.
Oh.
If they get pent up, anything that is pent up will rot. So they will develop infections, pneumonias, and what we call in medical language atelectasis. And that can be a big problem, sometimes will cause death. So the respiratory exercises have to begin immediately. They have to start doing breathing exercises, chest exercises, shoulder exercises, see that all the muscles become supple, and then the body should be in movement. They cannot lie just like a log for a long time, otherwise they will develop back sores.
okay.
And so immediately after they wake up, the program begins. If we have done a minimal invasive surgery, minimal invasive surgery is now very common in our hospital or any hospital. So for them, we have designed as a fast-track physiotherapy program where immediately within hours we get them out of bed and their physiotherapy starts. But this acute phase, the physiotherapy starts in the bed.
Okay.
Then when they are mobilized in the ICU, they are moving around, they are able to climb a couple of steps, then they come to the room. And at the room, then we take over about not only teaching them the proper exercises, making them more mobile to even climb steps, but also proper breathing exercises. It is quantified. There is something called the respirometer, and there is an incentive spirometer where the patient can understand that whether he is doing that respiratory exercise correctly or not, and there are balls which move with the force of his expiration, etc., where he can know how well he is doing. And then the other part about the atherosclerotic risk factors, the dietitians coming, and they will talk to him about at length about the diet, the family, the children, the wife. There will be also enough peer pressure created about disciplining his diet, and so on and so forth. And by the time they go home, they have been fully counseled. And at the end, either the consultant will sit down and give a holistic counseling. But then after that, there could be a subacute phase where the physiotherapist will take over either at home or he comes and visits to the department, and a gradual exercises depending on whatever is physical condition. There are tests, VO max test, counted in METs, and the heart rate. There is something called maximal heart rate. What is maximal heart rate? You take 220 minus the age, and that is a maximal heart rate. But nobody can really do the maximal heart rate. It will be too much of a strain. So, say if it's an athletic fit guy and doing marathon, we would say 75% of his maximal heart rate. If somebody is a young guy but he's not a marathoner, we would say 70%. But somebody is a patient, like a heart patient who is recovering, then depending on their conditions, it may be anywhere between 50 to 60% or 65%. And they have to achieve that heart rate while doing the exercises and not cross that heart rate.
Okay, so while they are in the hospital under the care of handsome doctors, beautiful nurses, the patient is fine, he's comfortable, he's in a comfortable zone over there. But once he gets out of the hospital, I have met a lot of patients, that fear is there in them. That can I walk, can I run, can I talk, can I laugh, can I go out, can I go to the shopping malls? How do we get him to get out of this fear?
That is where counseling comes in.
Okay.
Counseling has to be articulated well, it has to be idiot proof, it has to be their level. And unless that is done, they will go with fear. And it is a counseling not only the patient,
the family.
Our kind of families, they are not like the Westerners.
Yeah.
All the family will be together. It's a good thing. But there is a bad part of it. There will be too many extra thinkers who would go on harassing him. So the family has to be counseled. They have to be told what is rehabilitation. And it has to be structured. They have to be trained how to see their pulse rate, or there can be oximeter where they can see the pulse rate. And if they are instructed well, all this will not happen. And the best thing is if they can come and attend the physiotherapy department, a proper graded rehab, nothing like it. If they cannot, sometimes we have facility everywhere of home care, where the therapist can go to their home. But you have to understand a therapist is a guide.
Yeah.
Whole day what they do is under that guidance.
Yeah.
If they think that he has come and gone and that's it, and they just lie like a log, no. The family and the patient has to understand that every hour they must keep doing it. And then after a month, the therapist will stop. And they should not think that it's over. The diet, the exercise, all these things are like...
It's a continuous process.
All their life.
Okay. Let's take a patient who has undergone CABG, or let's take a patient who has undergone just stenting.
Okay.
When do these people actually start their physical activities? Is it that a CABG guy has to wait for about 4 weeks?
Stent guys, by next day, they're bounced.
Great.
By the time they go home, they're at work.
Okay.
A person who has undergone a bypass surgery.
Yeah.
He has problems. He has got a cut in the chest. He's extremely afraid, so he's holding his chest. And there are multifarious problems, both physical and emotional. So they will require far more attention. And they are in the hospital anywhere between 5 to 7 days. They go home, and max about 20-25 days they should be out of the house.
The guys who have undergone CABG.
Undergone a bypass surgery.
Great.
Great. They should be out of the home in 20-25 days. They should go back to their work.
Yeah.
And once they go back to work, they start doing everything. They are climbing stairs already. By the time they get out of the hospital, they're already climbing one flight of stairs.
Great.
So they get back to work, but they don't suddenly start overworking. They take it gradually. They train them. and how to check their heart rate, how to see whether they're all right or not, what symptoms are warning symptoms. And in a month's time at work,
it should be normal.
Back into hard work, normal work.
Great.
They should be able to compete with their colleagues eyeball to eyeball. There should be no complex that, oh, I underwent a bypass surgery. No, that's not required.
Yeah, so this is really, as you say, counseling is very, very important over here.
Important.
What if the patient's ejection fraction, even post-surgery, is somewhere around about 30, 35, 40?
Yeah. What you are saying, ejection fraction is low, means what? What is ejection fraction? The heart dilates completely during a relaxation period.
Okay.
Then it constricts completely during the ejection, during the pumping of the blood out. This difference between both is called as the ejection fraction, the ratio. Normally it should be 60%. If it is low, that means the heart is not pumping well. Your heart, if I scan, is like this. If somebody's ejection fraction is 30%, 25%, that heart will be like this. Now that guy has to be, that man or woman has to be managed with kid gloves. So there are a lot of instructions for them. Their salt restriction, fluid restriction, the way they take rest, head up, and then the medications. But then how much we want them to exercise, we would have already calculated and trained them. And they would have been trained to understand how I increase my exercise. And we would have told them that you start with, say, 5 minutes of walk and then increase every day by this many steps. And today's phones, today's watches, they can tell you the steps.
Yeah.
And he can go on increasing, and say over a period of a month, he can be back at that exercise level that we want to do. And most of the time, this exercise, aerobic exercise, is a walk, a warming phase, 2-3 minutes, and a cooling phase, 2-3 minutes, and then a brisk walk. And he looks at his heart rate, he looks at his steps. But walk alone is not enough, some amount of exercise required. After any exercise, if you don't do the stretchings, you start developing all kind of body aches. Which they keep on mistaking for heart problem.
Okay.
So that also has to be counseled to them.
Then, if they're really young and have undergone these surgeries, what about the youngsters who have undergone such surgeries? Have you come across any real young person who has undergone a cardiac bypass surgery?
Somebody who is less than 50 is 30% of my lot.
Oh my God.
And not at all uncommon for me to be doing a bypass operation or putting stents on patients who are in their 20s and patients who are in their 30s.
Okay.
But the rehab program is same for all.
Okay.
But these guys, if they don't have they have not damaged the heart, and the heart pumping ejection fraction is good, and they can be fast tracked.
Great.
And
So
all of these patients, you must understand that if they are counseled well, if they are rehabilitated well in a good structured manner, they should be able to compete with all their colleagues like how they are. They don't have to be specially treated that they are weak, they are not good. Otherwise, all of them will fail in their careers. No, they are as good. They are prime ministers, CEOs, presidents, ministers who have undergone surgeries, and they are doing Manmohan Singh.
yeah.
He's the best role model for people. People say stress, stress.
Okay.
Can you imagine any stress on anybody's job compared to Manmohan Singh?
No, not at all.
As a prime minister of this country,
Not.
under those mother and son. Okay. Now he underwent a bypass surgery in London.
Okay.
Now after his first term, he underwent another bypass surgery.
Okay.
And then Congress won the next election.
Okay.
And they offered him to become the PM.
Okay.
And he took it. And look at him. Did he get any stress? What happened to him? He was bouncing. He was working so hard. And everybody was stressed, not he. So by the stress standards, he wouldn't have survived at all. So the stress is not in any job, not anywhere. It's in your attitude.
Okay.
But a person who has undergone stents or bypass surgery, Manmohan Singh is a good example, should be able to compete, work as hard as anybody else.
Must I stay as
doesn't have to control his aspirations or ambitions or whatever he wants to diversify.
Yeah. So do you think Manmohan Singh's silence is the reason for him to be?
No, it's attitude.
Okay.
Stress is in you, not in the job that you're doing.
Okay, that's great. Yeah.
Somebody is doing a small job and he's so stressed. And so I tell them all that your role model is your ex-prime minister.
Yeah.
Think of his face.
So as one of the leading outstanding cardiothoracic surgeons, you've been in the field for almost 40 years. What is the best advice you like to give people in general, our viewers over there? So how to take care of the youngsters, how to take care of the elderly people with cardiac problems?
Okay. what you are asking me is prevention of heart problems,
Yes.
heart attacks and strokes.
Yes.
Okay, you must understand the World Health Organization and the UN has been doing so much about it. This World Heart Day business, the circus that happens every year, is only to drive the point inside everybody's mind that heart attacks and strokes are preventable to the tune of 80%.
Oh.
And the World Heart Day, what we celebrate, its aim is by 2025, when we started off, till 2025, there should be 25% reduction in this 1.7 crore deaths that happen annually across the globe because of heart attacks and strokes. Simple formula, don't smoke. About smoking, there is no controversy, there is no...
Absolutely nothing.
There is no, and it is all or none phenomena. You smoke one puff or you smoke 3-4 packs of cigarettes.
It's the same.
It's the same. So there is no ifs and buts, there is no negotiation, no smoking. Second thing is right eating. Third is physical exercise. Simple walk, half an hour is enough. But again, as I told you, follow it up with some stretching.
Yeah.
And then moderate alcohol.
Okay.
And then if you have middle obesity, make sure that you control it. And there are different ways, so many programs of control.
Yeah.
If you are having some bad genes and you've got blood pressure, you got diabetes, then you must diagnose that in time. That is why these annual health checkups are valuable.
Definitely.
These lifestyle diseases, you can catch them early. If you catch them early, say I have got diabetes or I have got blood pressure. I have a machine, sugar checking machine in my house. I have a blood pressure checking machine in my house.
Absolutely.
Every week I will check them and I know what is normal figure. And I will keep the normal figures. And if the figures are not normal, if the numbers are not normal, I will modify my drugs. My doctor is just a click of my phone away or a message away. They will all, guide me, and I can take care. If the numbers remain normal, the damages that would come to your heart, to your brain, to your kidney, to your leg arteries and nerves, etc., will not happen. It happens. All the problems of this lifestyle disease happen because A, you wake up late.
Okay.
B, you really don't follow the proper lifestyle. So if you just take care of 4 things, that A, the no smoking, food, exercise, and take care of your risk factors.
Yeah.
80% reduction in possibility of heart attack and strokes.
So it's so simple to remain healthy. Wake up early, do a little bit of exercise, eat the right diet.
And check whether my mother's family or my father's family are there these problems.
Okay.
If they are having those problems, on a general scale, 35, 40 years your party is over. You better wake up and be disciplined forever. If you have good genes, there's nothing, no history in your family, and nobody has got diabetes, hypertension, nobody died of heart attack, you are a little lucky. But I think it's generally a good idea that if you want to maintain your youth today, by today's definition of health, a man at 65 is still, we call him as a young man. Okay? If you want to be a young man, like you, 65, then you should lead some basic discipline like this. This doesn't bite, this doesn't bleed you. This is not very boring. It's very simple. That some exercise, disciplined food, no smoking.
Wonderful. I mean, that's a wonderful discussion, viewers, and I'm sure you people have learned a lot from this little discussion. But I'll just have a few questions which a couple of people have asked. One is a guy who's about 40 years old and he underwent stenting. He had 2 blocks. And the doctors were good enough to tell him, okay, you don't have to worry, it's done, there was a block, the block is removed, the stents are there, and you can go about your normal life. But his wife doesn't allow him to do anything. So he says, what do I do now? Get rid of my wife?
No. That's what I told you in the beginning. Counseling. Counseling not just of the patient. Make the family, the children and the wife sit. They are young guys, then their parents sit. They have to be told. Otherwise, a lot of families, out of their over affection, they may jail those guys.
Okay.
And it's very common in India. Because we are not like the Westerners. We are less practical. We are more emotional. And our family bondages are quite thick. It's not a bad thing. Actually, emotionally, that support is great. A lot of major incidences in life, people survive because they have this family support. But family support like this can be very dangerous. So counseling.
Yeah. And then there was a slightly senior guy, and he's supposed to go for a stenting, maybe even a bypass surgery. But he says that if it's going to interfere with my sexual life, I don't want to go for it.
Okay. No. this is a myth, like about vaccine people are talking now.
Mhm.
People think that if they get vaccinated, they get sterilized. There's nothing like that. Most of the time, erectile dysfunction is all here. It's not there. There is bypass surgery, stents, even his heart attack. It doesn't cause any interference with either erectile dysfunction happening in him or even a premature ejaculation happening in him. It's a totally different ball game.
Okay.
And if it is there, there's a specialty called andrology.
Okay.
Those guys will give them counseling and address them properly. And by the way, we're talking about stents and CABG. Who should get stents? Who should get a bypass surgery?
Yeah.
Is extremely clarified
Okay.
by European guidelines, American guidelines, Japanese guidelines. All the insurance companies are extremely aware about that. So anybody who has got all the three arteries blocked or bad left main block, where left main divides into two left side arteries, those patients have to undergo bypass surgery.
Okay.
Somebody is having a tight, short, single block or simple, straightforward blocks in one or two places. For them, it's a stenting.
Okay.
Stenting or bypass surgery is indicated by the fact that that particular technology will make the patient live long, and those operations or the stents will not fail for a long time.
Oh, great.
That's how the indications are made.
Okay.
They're very clear.
Yeah, so from this discussion, viewers, I think it's wonderful to understand that life can be as simple as that. Get up early in the morning, do some exercise, have the right kind of diet, enjoy your life. Once in a year, go for your medical checkups. It's absolutely necessary. It's not that hospitals or doctors just want to make some money out of it. Not at all. It's to get your life right. So please go for your regular checkups also. And Vivek, any other advice you would like to give?
Your original topic was rehabilitation.
Yeah,
program.
yes.
So let us drill into everybody. That
Yes.
Somebody in your family has suffered a heart attack. Somebody in your family has undergone a bypass surgery. Somebody in your family has undergone a stenting.
Yeah.
I think they are in a very fractured state of body and mind, and they must have to go through a proper structured rehabilitation program, a proper counseling. If it has not happened well or he has not understood, you must get it repeated. And rehabilitation is a lifelong process. But the first intensive 4 weeks program has to be well structured. And if it cannot be done in the hospital, you can't manage. There are possibilities of therapists coming home. If the Muhammad doesn't go to mountain, mountain will come to Muhammad. But it has to be done. So that
Great.
point I wanted to stress.
That's lovely. I mean, so once again, it's post-surgery, post your cardiac ailment, it's a rehab, cardiac rehab, and cardiac rehab. So thank you, Dr. Vivek Jawali.
Understand everything crystal clear.
Yeah.
Don't mix up emotions in all that.
Yeah.
And don't do anything with half-baked knowledge.
And you can always get to the experts for advice. You can always get to us. We're always there to
Only
serve you.
expert advice and no neighborhood advisors.
And no Google advice. Be careful of Google. And is there anything else, Dr. Vivek?
Whatever you can ask me.
Yeah. So I think before we really end, I must thank Dr. Vivek for giving us his precious time. He's a busy man. He's got a queue of people waiting for consultations. But in spite of that, he wanted to tell our viewers about how cardiac rehab actually helps to make your life very comfortable, very much better. So once again, cardiac rehab is absolutely important. So before we close our discussion, Dr. Vivek, I always say this. We must mention about COVID. We are still far away from its being done. We must still wear our masks. We must still use our sanitizers. We must still maintain social distancing. And please don't be under the wrong impressions of the vaccines. They are good, and I think everyone must take the 2 shots of vaccines. Whichever vaccine is given to us, please take it. Am I right, Dr. Vivek?
There are too many wrong messages are going about vaccine. All vaccines are same. There was some hangama going on that is AstraZeneca vaccine, which is made in India, which is made in UK, has got a problem. No, more than 2 crore people have undergone this vaccination here in the country. We have not seen anything like that. The Europeans who are talking about it, they don't have this vaccine. There is some business ballgame going on between Pfizer and other people. Don't get worried. There are a lot of people who think there is no corona and it's all a humbug. No, you don't understand. It's a war in UK, it's a war in USA. And don't think that corona is going. Everybody is talking about second wave. There is not a single nation in this world, not a single geography in this world which has got escaped from a second wave. We are no exception. Already Bangalore has started seeing 1,000 cases per day. They are going to rise. Be careful. In my own known people from high level of society, I'm seeing one by one people coming positive and getting admitted. The problem is when the people say that no, we'll not die, the disease, nobody dies. They may not die, but I see in my hospital, the whole family will come for admission. Multiple people will come. Do you know what is that? What a financial blow that is?
Absolutely.
A lot of money is wasted. Don't waste your money. Don't get your senior people in a life-threatening kind of situation. They will suffer like anything. And understand that your false bravado is very idiotic. Wear mask, keep your hands clean, keep distances, and don't. I see so many marriages are going on, so many functions are going on. People are all huddling together. I was quite amazed when I saw the Kisan rally going on around Delhi. Don't do all that, because once the problem hits the roof, it will be too late, and some of you will suffer like anything. And suffering is both physical and financial. Be careful.
So thank you, gentlemen, for sharing your time with us. And I think Dr. Vivek and myself will both get back to our masks. Stay home, stay safe,
Yes.
and be masked.
Yes. Here we go.